As Taiwan's demographic changes, older adults have become a major driving force of the fitness industry. But senior clients have unique physical limitations, and their progress may be slower compared to younger adults. To meet the needs of this group, fitness trainers need specialized training. Today, in our Sunday Special Report, we meet certified professionals who guide seniors toward healthier and more vibrant lives.
Despite the rain, these students have gathered right on time for the 10 a.m. muscle conditioning class.
脚跟在地上，好，我们等一下要做一个体前弯哦，所以我们手放轻松。
Look close and you'll see they're not your usual gym buffs. Many are silver-haired retirees. The average age of the class is 75.
地方平常
多了，这半年这腰老是酸，会酸痛，然后行动很不自由啊。
推上去 Y， 好，下来变 W， 对。
Seniors today are more eager than ever before to take classes to stay fit, but effective instruction requires specialized knowledge.
我算体育科系出身，但我不是选手类型，就是都念学科的这种。
I studied physical education in school, but I wasn't an athlete myself. I focused on the theoretical side. In Taiwan, there are quite a few courses for senior fitness trainers, but they don't all provide certification.
By law, fitness trainers for the elderly aren't required to hold certification, but certification is still the main way of assessing a trainer's abilities.
我们在应征教练的时候，主要有设定3个项目。那第一个就是教练他本身要有3年以上的教学经验。
When we're looking to hire a trainer, we look for 3 things. The first is at least 3 years of coaching experience. The second is certification as a senior fitness specialist. The third is actual experience teaching seniors.
往后坐，但是膝盖一直打开。
In Taiwan, there are 2 types of certification for senior fitness specialists, national and private. National certification is issued by the Sports Administration. It's been available since 2013, but is notoriously hard to pass. To date, fewer than 1,500 people have obtained it. In comparison, private certifications are more accessible and varied, with at least 10 organizations offering them. One of them is the Health and Exercise Association ROC. It runs a 2-day certification workshop for senior fitness specialists. The final exam is 2 hours long, covering both theoretical and practical components. Today, one of the proctors is Ruby, a trainer herself. She says the test doesn't just assess professional expertise. It also factors in interpersonal skills and the ability to communicate effectively.
首先就是称呼他们很重要，千万不要叫阿伯阿姨。
First off, how you address the students is very important. Never call them uncle or auntie. Call them brother or sister. After that, you've got your small talk. Have you eaten? And how do you sleep last night? You have to engage with them. After that, you've got to play music. Music that old people like. That's a handy trick of the trade.
As more seniors take up exercise, courses for trainers are on the rise. Certified trainers enjoy a strong career outlook. She wraps up warm and grabs her microphone. Then she's off on her scooter, zipping through the streets and alleys. 34-year-old Wang Tingyuan is a traveling fitness instructor for the Taipei city government. She mainly leads aerobics classes for seniors, focusing on overall physical form.
现在就跟着我们一起把我们的手指肌肉做一些活动吧。好，来，右脚准备踩4下，行春春行，蹦蹦脸儿红，都是为了你。
Wang has been a fitness trainer for 15 years. In order to teach seniors, she obtained multiple qualifications, including one in senior health and wellness. She's also certified in physical conditioning for special populations.
我觉得理解特殊族群在他这个病况，比如说糖尿病的对象。
I think it's important to understand special populations and the physical conditions they might have. For example, some might have diabetes, and some might have osteoporosis or arthritis. Their bodies might be limited by these real conditions, and trainers need to understand that to a certain degree. Only then can trainers know that their students can't do certain things. For instance, most people can lift their arms to this height. Why can't they do it? With that understanding, we can provide safer training exercises that fall within their restricted range of movement.
Even with her string of certifications, Wang says that what's key to teaching seniors is communication and establishing trust.
很好。其实刚开始，我以前是不会讲泰语的人，所以我10年前就是进入到乐龄的这个据点的时候，我就发现
When I first started out, I was someone who could not speak Taiwanese. 10 years ago, when I arrived at the first service location for seniors, I discovered that they would sometimes speak to me in Taiwanese. So when I went home, I memorized the Taiwanese terms for various joints in the body. They would correct me, and I found that to be great fun. I said, I'll teach you how to exercise, and you can teach me Taiwanese.
Over the years, Wang has earned trust and won hearts in her senior classes. She's taken her students on adventures to try stand-up paddleboarding. To them, she's like a beloved family member.
感觉非常好。那个圆圆老师啊，他都一直咚是这样子。
Learning with her is great. Teacher Yuan Yuan is just go throughout the entire class, and she gets along with us so well.
圆圆大概8年有了，像我们家小孩。
We've known Yuan Yuan for about 8 years now. She's like our own child, and she keeps us in good shape. I'm already in my 80s, but I'm fit as a fiddle.
But as older adults develop chronic diseases or other medical issues, they become prone to feeling sore after exercise. That soreness can create a reluctance to keep exercising. Instead, students might seek out medication from a doctor.
所以我们其实一直很希望可以创造一个跟医师，然后跟物理治疗师，然后指导员的一个三项的一个管道。
What we really want to do is create a 3-part care pathway from doctor to physiotherapist to fitness trainer. After injured seniors complete rehabilitation, they will need to start restorative training. At that point, the responsibility can then fall on the fitness trainer, who works with the seniors to strengthen muscles and improve physical movements to help adjust their fitness. I think that this is the way to provide comprehensive care.
台湾健保很特别，拿药很便宜。
Taiwan's healthcare system is unique. It makes medication very cheap and accessible, and so many chronic diseases are routinely treated with medication. At first, one pill is prescribed, and if it's not effective, another pill is added. You'll find that many older adults leave the hospital like they had just gone to the supermarket. There's a bag of medication in one hand and another bag in the other, altogether containing a dozen types of medication.
Sports medicine physician Wan Tzu specializes in treating chronic diseases. Besides providing the usual clinical care, Zeng can also write exercise prescriptions for his patients. He believes that drugs can target diseases, but that only exercise can heal the person.
就因为做这些研究以后发现，第一个运动有效。 就是运动真的可以当作药。
From conducting these studies, I have found that exercise is effective, that exercise can really be a form of medication. Doctors before us have long known that medications interact with each other. If exercise is a form of medication, then it will also interact with the actual medication. Doctors have to understand the interaction of the two. They can increase the amount of exercise on the one hand, and on the other, reduce the amount of actual medication.
会容易饿，OK， 这个要注意，这个就要看你的用药。这个时候我要调整，尤其有些药会让你血糖变太低，才会饿。那如果还没在看药之前，那你那个药单最好给力哦。
Zeng first asks the patient about his daily routine and medication intake. Then he writes a prescription for exercise, which the patient can take to a partner fitness center.
越走越快。其实就是看，我们按照
Basically, we follow the exercise prescription. Once it's done, the data is recorded, and Dr. Zeng is consulted about whether adjustments should be made.
吸一口气，吐气，打开伸懒腰，哈。
Through the power of exercise, seniors can not only improve their health, but lighten Taiwan's medical burden. Senior-focused trainers play a pivotal role in making that happen.
其实我真的觉得这个工作很辛苦，但是这个工作能够帮助到很多的人。
I do feel that this job is quite hard, but through my job, I can also help a lot of people. All of us trainers have a sports background. Since we have the specialty, this expertise, why not use it for good in more places, to be a ray of light for more communities in society?
2位老师底加了哈，等一下呢哈，有任何动作我们都会随时下去帮大家调整哦。
As the senior fitness culture grows, more professional trainers are joining the ranks, providing a way to be active and thrive even in old age.